I think a lot of people were expecting to hear today what the time frame looks like for the general public. For instance, you mentioned between 4 and 5 weeks, I believe, in French, and also for the second dose, particularly for cancer patients or people who might need a second dose sooner rather than later. Are you able to give us a time frame, even if it's just a rough time frame, for all of the other people who are waiting to get vaccinated?
Well, I think, as I mentioned, there are many variants. I don't know if that's the right word, using variants right now, but variable, I should say, sorry, that take into account. That's the reason I don't want to be so precise, because we don't know. What we know is if we receive the vaccine as we're supposed to receive it, by the end of April, we will be in good shape, because we should, if everything goes well, we should have done a good part, a good portion of those category 8 and 9, which precede the general population. So I think it's a bit premature to put a date, but we will talk to you every week, and we'll tell you how we do in those two important categories, with the special workers and the people with chronic disease. Once they represent about 1 million people for across Quebec. Just on the island of Montreal, we're talking about 300,000. So depending on the speed we are able to vaccinate those two categories, then the general public comes after. The good news is that given the allowance that we have from public health, we're able to go faster in that category of general population, and that's the reason we allow the people with 55 and over, which are part of this general category, to be vaccinated with AstraZeneca. That was unplanned, and hopefully that can help us vaccinating the general population much sooner than we were expecting. That's the good news.